want to thank everybody for coming tonight to hear this, and look forward to your thoughts, opinions, and whatever you think. Most of you will have been to a conference before. They've evolved over the years, and I mean, I think 2019 was our last one, which ran over basically nearly 4 days. As everybody will be aware, that due to COVID, we've had to rethink what we're doing for 2021, and so it's going to be a conference, as it says, like no other. We're still planning to hold the conference in May 2021, subject to things like COVID easing, and as a byline, a lot of our Scotland has now gone into full lockdown, so it's not easing at the moment. And we'll need to get permissions from different people for it to go ahead, because I've been in a hotel and everything that goes on with it. We are expecting there's going to be quite strict protocols required for the conference to be able to go ahead. So everything we're planning is taking all this into account. You can imagine it's not that easy. We've met with the team at the Vocal St John's Hotel, which for those that have been to previous conferences, it's the one we've used for the last few years. We've identified how many people can be present at the conference under the current separation criteria. We've agreed the catering arrangements, and we have a draft outline as to what the conference could look like. I think people have to be aware that it's an ever-shifting sands, and it could change, but this is what we're planning just now. The biggest difference is that the conference this time will be run over 2 days. There'll be, previously we've had the Friday night pizza. Last 2019 we had the newbies dinner, because we found more and more people were arriving at the hotel on the Friday for the Saturday and Sunday. That's gone. There'll be no pizza night. There'll be no newbies welcome dinner. Conference will start on the Saturday morning and conclude on the Sunday afternoon. There'll be a single venue for presentations, and that'll be the big room that people are used to being in for all the stuff that's done together and for the main presentations. So it'll be one stream in there instead of having 4 streams in the separate rooms, and how we will present will also be a little different. But we'll leave that because it's Nigel up next, who's going to talk about the programme content and what we're going to do.
Okay, thank you, Hazel. So the programme for Saturday, we're looking to focus on our UK SMS community. What we've learned from our demographic study has helped us to plan our regional programme, and we've also been investigating how we can engage with our supporters in the way that you want us to. And this is especially important when we look at digital and online platforms. So for Saturday, we'll be having this regional peer-to-peer supporting theme with an emphasis on our parent and carer health and well-being. We also want to cover future planning with guest speakers presenting on the likes of education plans, transitions, court of protection deputies, guardianship orders, trust funds and wills. There will be entertainment on the Saturday evening, but I'll let Nick pick on that one in a moment. Sunday is intended to cover the topics at the heart of Smith-Magenis syndrome. It's going to run in shorter segments, and we're looking to invite speakers to present short subject overviews before becoming more of a discussion panel. This should be a quick fire appraisal of topics such as the genes of chromosome 17p11, sleep matters, what we know about behaviour, diet and weight, etc. A lot will depend on what speakers are available, although we do hope to have key presenters join us through video conferencing as well. We are hoping to be able to set aside areas outside of the main conference room for what we're calling curbside chats with our speakers. So these will be for individuals to book a slot to actually follow up on anything that's been raised with them more on a one-to-one type basis. In the main conference room, tables will be allocated. On Saturday, we hope to do this where you live, so the regional theme. On Sunday, we'll try and do this by the age of your SMSer.
Finished. Thank you, Nigel. Right, so creche, we've spoken with Tinies. Tinies are operating under different rules, as you would expect at the moment, but they are still okay to provide the creche. Numbers will be different because the rules have changed. Trips out that we've done for the past few conferences where the siblings go out for the day, which has benefited everybody really. That's not going to be happening because of the restrictions, and we will underline that, say it is definitely not going to happen this year. We're still working out capacity because a lot is going to be dependent on total numbers. With the booking itself, we will have a priority booking system. So depending on where you fit, if you've never been to a conference, if you've just been diagnosed, you'll get preference over somebody who's been to all the conferences. If it's your first conference, you get prioritized, and we will do it on that basis. Catering on the Saturday night is going to be different. Everything is going to be blooming different because we're going to have to work with the hotel. They've got to keep to very strict guidelines. Everything will be table service. There's not going to be buffet breakfast. Lunch will have to be in 2 sittings because of the quantity of people. There's going to be a lot that is slightly different and may well change right up until the last minute. Hopefully, we'll get this magic cure from Boris and everybody will be injected and it'll be party time. Saturday evening will be similar sort of thing as we normally have, but without people being able to get up and dance. So it'll be a table service. We'll have cabaret style entertainment. Justin will be there. Magical Mayhem will be doing the balloon modelling and the magic show. Kiara Harvey will be there doing some singing. Photo booth, obviously that's not going to be able to happen. But we are trying to keep it as sensible as possible. And we do have to follow these strict guidelines because the hotel won't allow us to, the police won't allow us to, and common sense won't allow us to. Over to Nigel.
Hey, thanks, Nick. Now, Nick's already given some indication of how we're considering the prioritisation of booking. Now, the park suite capacity is what determines the number of attendees. Current social distancing rules, we are limited to 28 tables of 4, although there is the potential to accommodate families of 5 or 6 around one table. This gives us a working capacity of 112 attendees. Now, typically, we are between 250 and 300 delegates for our conference weekends. The maximum family group booking this time round will be 6 people. Bookings will be based on a package covering the Saturday and Sunday presentations, Saturday night bed and breakfast accommodation, and the Sunday night cabaret. Presently, we will not be offering day delegate options. Additional nights bed and breakfast for the Friday or the Sunday will be available for staying at the hotel. The opportunity to book for the conference will be phased by groups. Notifications of bookings opening will be sent to the current members as they happen. Earliest booking to the conference and the creche will be offered to those families who received their diagnosis of SMS in 2019, 2020, or those yet to receive it in 2021. And the whole family, the parents, the person with SMS and their siblings will be within that first booking group. We will follow up on a similar basis with those families who have been part of our community for a little while but have yet to make it to one of our conferences. The third group will be all of our SMS member families. If we are seeing high demand, then we may have to make a hard decision of restricting spaces for one parent with their SMSer, with the discretion for siblings if no other support is available. Fourth on the list will be SMS families who are not current members of the foundation. And then we will move on to professionals and then other interested parties. A waiting list will be kept for anyone who would like to attend but missed out on being able to book places in the first wave. This is both reflecting that there could be people dropping out, or we may very well be able to increase capacity nearer the time. What we are intending to do is record and stream the main sessions for anyone who cannot attend in person. And then I'll pass back to Nick for an outline on our pricing.
Okay, thank you, Nigel. Pricing, we're going to retain our existing structure where we charge the families the cost for the bedrooms and the delegate rates. We're going to keep it free for everybody with SMS to attend. Details of the pricing will be released as soon as we can, as soon as everything's confirmed by the hotel. It will be pretty much the same as the last conference, which was really good value. Hopefully, if everything stays the same. We've got to keep everything as safe as possible. If you've tested positive, or if you're waiting for a test, then you've got to self-isolate. You'll get a full refund. Well, we're not going to be punitive because it doesn't do anybody any good. But we're just going to keep reiterating the fact that we've got to keep it sensible and safe. If you're traveling longer distances within the UK, we're hoping to be able to offer the travel bursary, which we did last year, to help with the cost of attending if necessary. That's provisioned within our small grant scheme, which may also be applicable to help with conference costs. The bookings will be opened for expressions of interest. So we'll open that up on our website once notified, and it will be, you say, yeah, I'm interested, I want to come, definitely want to come, and this is how many I'd like to bring. And then we will compile all of those, filter them all out, shuffle them around, and then take it from there with a full-on conversation about how we can fit people in best. And that's over to Hazel.
Right, thank you, Nigel and Nick. I mean, that's that's the important part done. That's the information given. Although it's smaller in nature, the planning required for this is actually much more complex than doing the big one. We would really love it if members, we could get support from members in helping with the organisation of the conference, particularly if you've had experience in running events under COVID-19, or about health and safety planning, if you're in the entertainment sector, or anyone experienced, especially this time around, in virtual conferences and webinars. Conference sponsorship and corporate donations are more important than ever. Our venue costs are going to be the same, or consistent with previous years, yet we're going to have fewer people in attendance. So we'd welcome any leads, any people that know companies that we might be able to approach to help with these costs. Keep the date free, as they say in modern parlance. Save the date. I think the very important thing to finish with is that we intend to run a full normal conference from the 29th of April to the 2nd of May 2022. So instead of waiting another 2 years for the conference, it'll only be 12 months after this one. But we felt it was important, if we could, to still run something next year. And it just means that, for the future, that we might be on the even years instead of the odd years. Right, open to questions.